And so it's something that is really important to think about, and something that we have been working on for at least 3 years now to get some programs in place to help out with that.
And I have a child that just recently graduated a couple of years ago, and one that's still in high school, and they'll tell me all the time that it's so easy to get prescription drugs in schools.
Oh my gosh.
Mm-hmm. Yeah, especially in middle school. It's a big thing.
The statistics that you are getting, though, those are like students take a survey and anonymously they fill out the information, or how do you get these stats?
So those results are specifically from our Healthy Youth Survey, which is given biannually in all the school districts in Benton and Franklin counties.
Okay, well, that is a big problem. So where are the teens getting the drugs? You say at school, so they're buying them or getting them from other students, but ultimately, where do they get them?
Sure. So nearly 70% of all youth that abuse prescription drugs get them from friends or family. And so under 10% of that is with their knowledge. So when you have prescription drugs in your home and they're just in your cupboard and you're not monitoring them, or you're not in need of them anymore and you don't dispose of them properly, youth have access to those. And it may not be your kids, it might be your kids' friends, or it might be, you know, the neighbor who comes over to borrow some milk. You know, you just don't know. So it's a big piece that we're working on with the whole community to lock up your prescription meds and to monitor them if there's something that you plan on keeping around.
Okay, so literally they're getting them out of the cupboards.
Yep.
There's not another pipeline that the supply comes from Arizona or whatever.
No, it's so simple, which is why like this movement, you know, of protecting the youth from substance abuse around prescription drugs is such a simple task. So we are going to be working with the community on a few community-wide efforts that we're excited to share about today to reduce that, because it's just simple. It's as simple as locking them up. It's as simple as making sure you know what you have. It's as simple as disposing of them. And that would reduce our drug use here in the Tri-City area in Benton and Franklin counties. So
it does sound simple in a concept and an idea, but obviously, you know, it's not going to happen overnight. I want to get back to, I got a couple of other things I want to know before we talk about your, they're not solutions, but they are solutions.
They're strategies.
Yeah. There you go. Oh, I love that word.
Yeah.
Okay. So are young people using this as a chronic problem? Like they're, like a lot of adults are doing it, using prescription drugs illegally almost every day or whenever they can? Or is this kind of like, let's go out and have fun on Saturday night? Or is it both?
Sure, well, definitely both. I mean, I'd say a party scene, there's lots of different ways that youth use prescription drugs. But on a day-to-day basis, prescription drugs are easily accessed, you know, easier than alcohol sometimes, easier than marijuana sometimes. And so, especially for our middle school students, you know, that might be some hydrocodones or some even, you know, Ritalin or Adderall, something that youth even have access to on a daily basis in their own homes or in their friends' homes. And so it's something that does happen all the time, every day, especially with our middle school students, but also among our high school students.
A middle school student? Why? What is the motivation?
Well, there's just less partying that happens in middle school. So when you're in high school, you have access to those other drugs of choice. Alcohol is by far the #1 drug of choice for youth in our state and in our area. And then marijuana, and then prescription drugs. So,
okay, but why does a middle schooler feel the desire to get high?
Lots of different reasons. To fit in, just to try it out, because their friends are doing it. Sometimes, especially, I know in the Prosser area, our youth depression rates are over 40% in 8th grade. And so to deal with, you know, things that are happening in their lives, you know, they might use that to escape. So the same reason you would use any other drugs, to have fun, to escape from problems, to fit in with others, all the same for prescription drugs.
All the same. All right. What kind of drugs are we talking? Give me some names so that people can identify and they could go home and look in their cupboards tonight. So what are those names?
Well, one of the most abused drugs is hydrocodone. It's overprescribed and it's underused, and that's what most people have laying around in their cupboards. Officer, have you?
Yeah, Vicodin, Percocet, anything similar to that. Anything that's mood-altering types of prescription drugs.
Mood altering, you know, but for people, older adults, I would say, that have had experience with that, it's like, well, that doesn't make me high, man. That just makes me want to go to bed early tonight.
Well, you're taking it as it's prescribed.
Oh,
so
okay,
you have
okay.
to, yeah, as a youth, I mean, they might take 3 or 4 rather than the 1 or 2 that are prescribed. Also, those are prescribed to you per your body weight. And so when you're looking at an 8th grader versus a 30 or 40-year-old man, like, their body weight might be half that, and so that one pill might affect them a lot differently than it would affect you. Just like alcohol or marijuana. All those things affect youth a lot differently. Their bodies are still developing. They handle tolerance a lot differently because they haven't really developed it yet.
Or they may compound it with alcohol, so it gives them a different type of high.
All right, hey, Pete, we're going to take a break here. We'll be back because then we're going to jump into what this coalition has put together as some ideas, strategies. I love that word. And strategies and coalition. Those two go together really well. We're back in a moment here on this Wednesday on Meet in the Middle. We're talking about teen use of prescription drugs and the abuse of them. My guests are Jennifer Dorsett with the Tri-CIA, and that stands for Community Involvement Action Coalition. Also, we have Officer Ray Aparicio, Pasco PD. So I'm so glad that both of you could be here today. All right, let's talk strategies. What are you going to do about this problem? What's going on?
I'm so excited to talk about it.
Wow.
Yeah, it's been such a long journey. Over the past year or so, we have been working with our local hospital in Prosser to put in a permanent prescription take-back program. And we did in May of last year, right before the summer. And it was inundated with drugs from surrounding areas, from schools, you know, that have unused meds. Just everybody was bringing drugs in. Nearly 300 pounds, you know, we collected in just a couple of months. And so what we did is we saw that there was a need in surrounding areas. And because we're a smaller community, and we didn't want everyone to have to come to Prosser to drop off their drugs. So we met with the police and sheriffs in all of Benton and Franklin County, and we said, look, this is a community need. Let's work together and make this happen. And that day, that minute, they all signed an agreement saying that they would help support long-term prescription take-back programs in the Tri-Cities. And so we have been working to get the police department's boxes, policies in place, all working together. The hospitals, Cadlick and Lourdes and Southridge, we've all been talking with them about getting the word out there about these prescription boxes that are going to be accessible to the whole community 5 days a week to use. So we're getting the word out there. Today, Pasco's box was delivered, and so they are so excited to offer that opportunity now. Did you want to tell them about your box?
Well, first of all, I want to say that as a police officer, I've been approached many times with people asking me where they can take their prescribed drugs that they want to get rid of, and as a police officer, it was hard not to be able to give them a place to take it. We were doing the drug take back twice a year with the DEA, and that was my only go-to. Well, twice a year in the spring and the fall, you can bring those drugs to us.
So save it until
right,
the date,
right,
yes,
right.
and then come only on that date.
And remember.
Yeah.
So we definitely are so excited that Prosser CIA, and as well as the Pasco Discovery Coalition, which is the Franklin counterpart to CIA, which I'm also a part of the Pasco Discovery Coalition. We're very excited to have this box, and you know, being able to take in those drugs that are out there, unused drugs, that giving them a home so we can get rid of them and out of the cabinets and out of the accessibility of the young kids.
So we shouldn't flush them down the toilet.
No, it's really bad for your water systems.
Okay.
It pollutes. There used to be a saying that you could put it in your coffee grounds or kitty litter and then pour water into it, and wow, what a process. Like, I don't know anybody who would even go through the trouble. And so most people don't. And so this is a great alternative. You know, we had those DEA take-back days, this past one, which was September 20-something this year. And Kennewick PD alone collected over 1,400 pounds in 4 hours of just drugs.
So look at how much is out there.
Yeah,
we
it's
don't
amazing.
Even, we don't even think about that. So tell me the practical things, Ray. I am, let's say I'm living in Pasco and I want to get rid of my drug. What do I do?
And it is so easy to. First, let's discuss what we won't take. So we won't take syringes or used EpiPens or liquids. So your cough syrup and all that stuff. We don't want that stuff in there. Basically, we just want your prescribed medication that you're not going to be using that you want to get rid of. And it's so easy. I personally, I'm so excited about this box, but I haven't seen it yet because I was at my office. I heard it came in, and but it's just as easy as dropping it in. So
I walk into the Pasco Police Department,
and we're on the second floor of the Pasco City Hall. The box will be there, and it's just as easy as dropping it in.
It's like a mailbox, and it's green.
Right.
Yeah.
So I drop it in, and I can't get it out.
Right.
Yeah. Okay.
Better make sure you want to get rid of it.
And it's locked up. Okay.
Right.
Wow. All right. So it's taken, a couple of years to get this together, but it is. Who is doing it besides Pasco?
So Kennewick PD is going to have their box. It'll be delivered before January 1st.
Okay.
So for the new year, they'll have a box open and ready for the public. West Richland currently has a box, and they've had one for a really long time, and they just don't advertise it because it's a little bit smaller. Their police department's a little bit smaller, and so I have a feeling they just didn't want to be inundated with all of Tri-City drugs. But it is available now and is ready to take drugs for disposal. And then also Prosser Memorial Hospital has one. So we'll be having one in each of those areas and tracking the drugs so that we can share with the community, what a great job they're doing, keeping our kids safe and keeping it out of their hands.
What about Richland? You didn't mention Richland.
Yes, Cadlick is looking at putting the box in there, and the Richland PD would be emptying their box and disposing of the drugs. But theirs isn't set to go in just yet, and so we're still working with them on getting that all set up logistically. It's a lot harder for a hospital to get a take-back box than it is for a police department because they already handle narcotics and drugs and dispose of them, and so it's a different process.
Okay, so very soon now this is going to be something that I can do on a routine basis.
Yeah.
All right, let's assume here that our folks in our audience are parents and grandparents, and they're going to have a house full of people this weekend. It's going to happen tomorrow. People are going to gather. Teenagers are going to be coming into houses. What should they be doing tonight?
Well, if this is a concern for you and you have lots of prescription drugs in your home that you don't need and don't monitor, I'd take a look, see what you have in there, and then maybe after everyone goes home, take another look and make sure that it's all there. And also having conversations even just with your family and with your grandkids about prescription drug abuse, like these are for me, not for you. Stay out of my cupboards, stuff like that. But also, they could cause you real harm. You don't know what they're going to do to you because they're not for you, and they weren't prescribed by a doctor for you. And so just letting them know you care about them, and you want them to be safe. And the safest thing is not to use prescription drugs that are not for you.
Yeah.
And on regular days, and it could be adults, it could be kids, but many times it could be their kids' friends. So, although your kids may never do something like that, you may not know what your kids' friends would do. So, that's just good practice to have it locked up or somewhere where they can't get it.
And speaking of locking them up, we're going to be having a huge event on January 9th at the Cadlick Healthplex. We are going to be giving away over 500 in-home lock boxes to people for free, and you can come and pick them up all day. We want you to keep your meds safe in your home if you don't plan on getting rid of them. So we are going to be giving those in-home lock boxes away on January 9th, which is a Saturday, at the Cadlick Healthplex. And we're really excited for the opportunity.
How does the in-home one work?
So,
how big is it? What are we talking?
It's a small little box. It holds like 12 to 15 bottles of pills, and it's got a combination lock that you set, so you know what the combination is.
So somebody could take the whole box.
Well,
though.
they could, but they could also take your whole cupboard now. It'd be a lot easier because they could just take one bottle. You know what I mean?
All right.
So yeah, it's just
locking it up.
yeah, it's a safer way. A lot of times with prescription drug abuse, they try to sneak 1 or 2 pills, and so they're not taking all of it. They just want to take what they can get away with. And so this is a good way to lock up your meds, keep them safe in home if you don't plan on getting rid of them. And if you do plan on getting rid of them, now we have a safe option for you to dispose. So try to cover all our bases.
Yeah. Well, other than, you know, somebody coming in and stealing the pills and all, but what, I'm going to assume that there are typically some behavior changes for children that might be using these drugs. What should parents or grandparents be alert to?
Sure. Like any drug, you'll want to look for withdrawn, mood changes, and not just pubescent changes, but like serious changes. Some kiddos will stop, you know, taking care of themselves hygienically, being secretive, like more than normal, but not really including you in anything that they're doing, and obviously hiding something. Can you think of anything else?
Yeah, sometimes it's the type of friends they're hanging out with.
Oh yeah, changes.
So they may have been with the same friend for several years, and all of a sudden they're with a totally different group, and you can see by the actions of the group that they're with what maybe they're into, or you know, there's something a little bit different about them.
Okay. All right. Well, you've given us a lot of information, and this is information that is geared for adults. So we're going to check our cupboards tonight. I really appreciate that the 2 of you have come in and shared this information, especially today. Today, because tomorrow our houses will be filled. All right. We'll be back in a moment here on Meet in the Middle. Don't forget that you can call basically any of the police departments, and you can cross cities. You can live in Kennewick but take your drugs that you don't need over to Pasco, to the police department. Give them a call and find out when they're going to have their boxes available, and you'll be able to do that. So I appreciate them being with us today. Today is the day before Thanksgiving. Tomorrow we're all going to join together in some way. There's just all kinds of interesting collections of people. I know families, extended families, just immediate families. Sometimes it's a group of neighbors. Sometimes it's a group of coworkers. Whatever it is, people gather together for this purpose of being thankful about where they are. Goodness sakes, we have an abundance here in our community and in our nation. My suggestion to you is that not everybody has a place to go. You know, we think about that. We think, oh, everybody's going to be with their families. Isn't that wonderful? But you know what? Some people aren't going to be. Some people don't have a place to go. And what I would throw out to you today and suggest, hey, why don't you put an extra plate at the table and invite a friend, a coworker, somebody that you know today does not have a place to go tomorrow. Give that some thought. Hey, I've sure enjoyed this week. We'll be taking a little bit break for the next couple of days. We'll have some repeats, but if you don't listen every day, you might catch a new program that you haven't heard before. I've really enjoyed our conversation today, and I hope that we've shared some new information to you. So have a great Thanksgiving, and express your gratitude. That's the way to do it. See you again.